Hello and welcome to Men's Health in My Perspective. I'm your host, Larry Hamilton, and in today's video, I want to talk about my diagnosis with prostate cancer. Every year I have an annual physical, and because I'm over 50, my doctor has included as part of the blood work a PSA test. PSA stands for prostate specific antigen. And when it's elevated, it's a good indicator that there's a problem with the prostate. It could be a benign problem, or it could be a serious problem, like prostate cancer. In 2018, in the fall, I had my annual physical, and my PSA numbers were elevated. We waited a few weeks and tested again, and the numbers went down, but were still above normal. So that was a red flag to keep an eye on things for the next year. So in November of 2019, I had my annual physical, and the blood work included the PSA test, and again it was elevated. And we waited a few weeks and it went down, but was still above normal. So my primary care physician said that I should see a urologist. So I made the appointment for a urologist, and that was in March of 2020. And hello, COVID. COVID-19 really threw a wrench in the works for all kinds of things. I happened to get the last appointment that they were seeing patients before the lockdown order kicked in. I live in Michigan, near Kalamazoo, Michigan. And so I squeaked in with an appointment, talked to the urologist, and he explained that having the elevated PSA, even though it went down and was still elevated, that was a cause for concern. And his recommendation was that I should have a prostate biopsy. And then he explained what's involved with that. Basically, they take a probe that is an ultrasound probe about the size of the thumb. They insert it into the anus, and they take 6 needle biopsies of the right side, and then 6 needle biopsies of the left side of the prostate, and then the core samples are analyzed looking for signs of prostate cancer. He said it is possible that you could miss a small cancer, and so you could go through the discomfort for nothing, or you could find that there is, making it appear there is no cancer, or you might find signs of cancer, and most cancers tend to be slow growing, which would be the kind to hope for, because if it's slow growing, basically they don't worry too much about it until things get to the point where they need to do something about it. I asked him his opinion, what he would do if it was him, and he'd say get the biopsy. My decision was also influenced because my grandfather, my maternal grandfather, when he was, I believe, 83, was diagnosed with prostate cancer, and in his case it was quite advanced, and he ended up having to be castrated. He had another form of cancer called multiple myeloma, which is blood plasma cancer. I don't know if those were independent of each other or if one led to the other, but seeing how miserable his waning years were, I decided I didn't want to do that, so I opted for the biopsy. So I had to wait a few weeks till they were back in business to see patients to get the biopsy. It was done in the doctor's office. The preparation is no food after midnight, and a couple hours before you go in for the biopsy, you do an enema to make sure you're cleaned out to get any waste products clear, so you're not taking waste from the anus and pushing it into the rest of the body. Before the biopsy, they gave me a shot of an antibiotic, and I believe I also had to take a pill just to make sure that there was no infection. You basically lay on your left side on this little couch. The doctor takes this probe that has ultrasound in it and the ports for the needle biopsy, and it's about the size of the thumb. I wanted to ask if they were comparing it to Andre the Giant's thumb, because it didn't feel as small as a thumb, in my opinion. And they have a numbing gel so that it minimizes the pain from the needle biopsy. Now, the doctor told me that it's going to feel like a bee sting. That got my attention because I'd been stung on my right pinky 20 years ago, and my whole arm hurt just getting stung on the pinky. So that had me a little concerned there for a minute. Well, then he inserted the first needle, and it just felt like pressure because they'd used the numbing gel. Now, perhaps for people that don't respond to the numbing gel or have a high sensitivity to pain, it might be bad. But for me, it wasn't bad. Definitely nowhere near as bad as a bee sting. So they take 6 biopsies of 6 cores from the right side of your prostate and 6 cores from the left side, and then they send off those samples to the lab to look for signs of problems. It was such that I drove myself there and I drove myself home. I was about halfway home when I started to feel some discomfort, pressure from my pants and my belt on my abdomen, and just discomfort from sitting. And that discomfort basically was gone by the next day. I, however, did not feel like riding my bicycle for a couple of months just because of the discomfort in that area. The other thing is the doctor warned me that there would be blood in my urine and possibly my stool for 4 to 6 weeks, and blood in the semen for about the same amount of time. And it's really strange to see purplish red semen, I'll tell you that much. The biopsy results, I think, were like a week or two. If you'll read my blog, I've got a timeline of all that. And my results indicated that 8 of the 12 samples showed signs of cancer. I believe it was 7 of those samples were a 6 on the scale, which 6 is the high end of the benign, or slow, or not benign, but the slow growing, non-aggressive. And so if they would have all been 6, we might have waited. But the other one was a 7, and a 7 is the low end of the aggressive type. And basically my prostate was full of cancer. Through physical exam and the probe, the doctor estimated my prostate was about double normal size, which she said was pretty typical. And his recommendation was that I needed surgery because he's a surgeon, but he said there were other options. I'll discuss all the options that I discussed with my surgeon, my urologist, and what option I chose and why I chose it. I want to encourage all men, or anybody with a prostate, if you're 50 years and older, be sure that your doctor is including a PSA test as part of the blood work for your annual physical. The digital exam, all that does is allow the doctor to determine the size of your prostate, and maybe if it's got an abnormal shape, determine that, but it cannot detect cancer. The PSA test, that prostate-specific antigen, is elevated when there's something wrong with the prostate. It may not be cancer, but it would indicate whether or not you need to do something about it. And it's the best way to find it early, because prostate cancer is very treatable if you catch it early. If you just ignore what the blood tests say and go on your way, in 10, 20, 30 years, you'll probably be regretting that decision. Also, I believe if you're 45 years and older and have a family history of prostate cancer, it's very important that you get your PSA checked as part of your annual physical blood work. And if your doctor is not doing the PSA test, and you're in the category of age or family history that you need to be getting that checked, you either get him to do that or you find another doctor, because you want to keep an eye on that so that you're not regretting that you didn't keep an eye on it. My goal here is to advocate for men's health and the health of anyone with a prostate and other issues that affect those with male parts. And I want everybody to be able to enjoy a long and healthy life. And if you have a loved one that has a prostate, encourage them to get it checked. It's really not that big of a deal. A blood test is not as embarrassing or invasive as a finger to check your prostate. And as I said, the finger doesn't really tell you a whole lot other than how big it is. I thank you all very much for watching. I would encourage you to go check out my blog. My blog is Men's Health in My Perspective at menshealthinmyperspective.com. You can also find me on Twitter at mensmy and Facebook at Men's Health in My Perspective, and of course at my YouTube channel, Men's Health in My Perspective. If you like this video, please like it, share, and tell others. Thank you all very much for watching. I hope you have a pleasant day and that this has been informative and helps you and encourages you to take care of your own prostate and other health issues.